Hey everyone, today I want to talk about public speaking. It's something I think a lot of people struggle with, but you have to learn how to be good at it for so many different kinds of fields. And I thought I would go into my tips and tricks for how to improve as a public speaker. Keep watching. I don't think anybody is born a good public speaker. You have to learn it. And there are seminars and classes and all sorts of things, ways to become a better public speaker. But I have just a few tips on how to improve as a public speaker. First of all, that's something I watch when I'm really public speaking. I say a lot, so that's one thing. That's tip 1/2, not tip 1. All right. When I was younger, I was extremely shy and I did not enjoy public speaking at all because I just felt so self-conscious about it. I actually did something which most people don't do. I did a lot of pageants. My parents put me in a ton of pageants, which is a little odd as I was born in New Jersey and as an Indian, daughter of immigrants, kid growing up in North Carolina. They put me in pageants, but my mom's thought process as a psychiatrist was that it would build my confidence and my public speaking. It actually really did. They coach you on how to do that interview portion, how to present yourself, and those are all really important things. So I'm just gonna boil it down because I'm assuming most of you aren't going to be pageant queens or toddlers and tiaras. So this is what I learned from that, as well as when I was in high school, I was up for a lot of scholarships, and our debate team coach took about 10 of us that were up for a really prestigious scholarship called the Moorhead Scholarship to University of North Carolina, Chapel Hill. And they coached us every week. I think it was like twice a week sessions, starting small, like your earrings are too big, it's distracting, or this neckline would be distracting for an interview or public speaking or whatever it is. So those kinds of tips are also really helpful, but I'm going to focus mainly for public speaking towards essentially a medical audience, because I know there are a lot of medical students follow me and residents and new attendings, and how I do presentations for a medical audience. So the first thing is, don't be afraid to ask for help. A lot of times med students or even college students are tasked with giving a presentation or giving grand rounds, and you don't know the subject matter at all. I mean, how could you? You're presenting to people that are experts in their field, that have been doing it for 10 or 15 years, 20 years, 25 years, and it's a really daunting thing to have to get up there in front of everybody in a podium and with a microphone and to have to discuss, even if just for 5 to 10 minutes, to speak eloquently about a subject that you know nothing about. So don't be afraid to ask for help. I was tasked with giving a grand rounds when I was a first-year ophthalmology resident, which is a PGY2. In your first year of ophthalmology residency, you are not doing cataract surgery. You haven't even seen cataract surgery at this point. But I was tasked with doing a grand rounds on a particular subtopic of cataract surgery, which is complicated cataract surgeries using this capsular tension ring. Again, I had no clue what that was about, but that was the topic they gave me. So I reached out to the person, one of the guys who developed a capsular tension ring. I was studying in Manhattan. His office was in Queens. He was super nice. And that's the thing. Don't feel that people aren't going to, you'll be really, really surprised to realize how often senior doctors or senior anything, lawyers, whatever, business people are willing to mentor if you just ask. They might not realize that you need the help. So when I called up his office, he took my call right away. He's super busy. And he offered to mail a DVD that night of his videos using that particular tension ring. And that was really nice. This is before YouTube, so obviously he couldn't upload it to YouTube. I'm clearly dating myself right here. So he went ahead and did that, and that was fantastic. I got it within a couple of days. So then I had this DVD, and I had no idea of what to do with it. How am I supposed to use this in a video when I don't even know what's going on? So I asked 2 of the more junior attendings in our residency program for help. So I went over to their place, they offered, and we just talked through exactly what was going on in each step. And they really helped me understand what was going on. Now, when I say ask for help, I don't mean ask someone to do your presentation for you, because that's just laziness. But you need to show that you've put in your work. I at least knew the different steps. I went in prepared for this meeting with the younger attendings, and I showed them that I wasn't just asking them to do it for me, but to assist me in my understanding of the topic, which really, really helped. So don't be afraid to ask for help. You'll be really surprised. There is no better way to combat nerves than over preparation. And I mean, just prepare, prepare, prepare. It's really unlikely that you're going to be the expert in a field at a really young age. If you are, great, kudos to you. But if you're like the rest of us and you're tasked with talking about a presentation or talking about a topic you're not as familiar with, then you really just need to prepare. As you get more experienced in the field, then those words are going to come naturally because you've gained the experience and you might well be the leader in that field. But when you're starting out, it's really nerve-wracking because you don't know what you're talking about as well. So just prepare. Nothing is going to make you feel more confident than being able to answer any question that gets thrown your way. And read every article, watch every video, read other people's grand rounds, ask for input. That's super important. Just prepare, because I always try when I'm giving my presentations to pause and have moments for people to ask questions. It breaks up the rhythm a little bit and it gets the audience involved. And if you can do that, if you're over prepared, then you know the answer to whatever questions they're gonna ask you. You're not gonna be scared to do that. So that would be my second tip for you. My third tip is make your slides visual. For medical, I mean, I don't know if this is really gonna hold true. I think it should for other fields other than just healthcare, but especially for medical grand rounds or nursing grand rounds or PA grand rounds or any kind of grand rounds in the healthcare field, you want to make your slides as visual as possible. Some people will even go as far to say that they have no words on their slides at all. But I'll show you an example. So this could be a presentation that I did, or this was a presentation that I did. Now, I could have just put a bunch of words on the slide and said, this is a 13-year-old girl that presented with skin tumors, etc., etc. Or I show the picture and discuss those findings. So that's a really key difference, because when you are talking about a photograph as opposed to just reading the words on a slide, you are involving your audience and you're engaging with your audience and they're engaging with you. And that really will make the presentation just be so much more well received if you're actually engaging with your audience instead of reading at them. They're going to fall asleep if you're just reading at them. I'm going to fall asleep reading my own slides. So I really try to keep it as visual as possible, use as many photographs as possible, very few words. I do still use some words, but I try to limit it and try to know my presentation so well that when I have the cue of a photograph, that I can then just talk about that particular patient or whatever it is. And don't be afraid to use that little notes section at the bottom of PowerPoint, or have your notes and look, you can glance down, of course. But don't put your words on the slide. I think that's a really important one. So on the slide on the left here, it's quite wordy. It has the chief complaint, the age of the patient, what she's complaining of, her review of systems, her weight loss, her vision, the examination of the fundus, all important things. And typically in the past, I would have done this slide and then shown this photograph. But now what I do is I simply show this slide on the right-hand side, the fundus photograph. And I know all of the information regarding the case on the left, and I just speak it. So I put this picture up on the right side, which is labeled fundus photograph. And I just say, this is a 14-year-old girl. She came in with 4 to 6 weeks of complaints of blurry vision, and her ability to read and write has decreased. Mom also notes headaches and weight loss, and her vision in the right side here was 20/150, left side was 20/200. You can see the papilledema, the flame-shaped hemorrhages and cotton wool spots. Note the hard exudates and the dilated veins. What do you guys think this is? And I leave a bit of a pause for people to mull that over in their head. I want them to think about what is the diagnosis, because if they make that connection, then they're more likely to remember it, versus if I just put a slide up like this and then I put up a second slide that shows that it's hypertensive retinopathy and just detailing all the findings of hypertensive retinopathy. This is going to make much more of an impact and your audience is going to learn from it. Fourth, let your passion show. this hopefully is something you're really excited to talk about, and that's why they've asked you to discuss it. Let your passion for your subject matter show. I think if your enthusiasm shows, then it really will infect your audience. And going along with that, you want to have a lot of extra energy when you're presenting. You want to have 30% more energy than you really think you're going to need, because that is the level at which you'll need to be able to project your enthusiasm for your subject matter. And that's going to keep people awake. And bottom line, you want your presentation to disseminate information in a knowledgeable way, but also in a fun and interactive way so that people come away learning something from your presentation. Slow down. That's my 5th tip. Slow down. That, you can probably tell, is a little bit hard for me to do. I'm a really, really, really fast talker. So when I'm giving a public speech about, or a presentation, I have to really convince myself to slow down. Not so much for conversational things like YouTube, but more for those nitty-gritty healthcare medical topics, because assuming that your audience does not know your subject matter as well as you do, there might be a tendency for you to speak quickly and then people lose you. So speak at least half the speed at which you think you should be speaking in normal conversation. That's going to be really key at making sure your audience understands what you're talking about. 6th, make every moment intentional. I have this tendency, and I'm really trying to limit it, but I talk with my hands to the point that my 7-year-old says, why do you always use your hands like this? See, I have my hands in my lap right now so that I don't talk with my hands, but I've had to draw that in and rein that in when I'm giving a presentation. You want to make those as moments of punctuation. So if you're really using your hand gestures intentionally and not just all over the place, which can be extremely distracting. And I think that's one way to get your nerves out also. So just have a certain place where you put your hands. So if you're a hand talker like I am, that you're using your hands intentionally so that doesn't distract from your presentation. And that goes also just in terms of being intentional. The kinds of advice that I used to get from being in beauty pageants or scholarship interview prep is being intentional with your choice of dress and intentional with choice of jewelry if you're a woman. All of those things make a big difference. You don't want to be moving your head and having jangly earrings that just distract everybody from what's going on. So it's simple about just keeping the focus on the talk itself. And 7th, my final tip is it's not about you. It's really about what your audience can learn from you. So remember that when you're preparing your talk, go with that in mind. You want to do everything you can to make sure that your audience comes away with a better understanding of your topic than what they came in with. And hopefully these tips will help you improve in your public speaking. Like I said, it doesn't come naturally to 99% of us. I've had to work at it and I enjoy it now. And I think being able to enjoy public speaking has opened up a lot of avenues for me in terms of building my practice, in terms of doing things that I want to be able to do to educate patients and other clinicians about my field of expertise of pediatric ophthalmology and adult strabismus and private practice management. So if you have any questions, please comment down below, like this video, and please subscribe to my channel. Thank you.